Yeah, so that's usually on the order of some months. I will tell my patients, think in terms of like 3 to 6 months for the full effects of any procedure that we do. So yeah, you do see the immediate results, but you want to continue even after that initial, say, 24 hours or so of having an ACE wrap. You want to continue wearing some type of support on your legs, at least during the day. Um, at the times when you're upright, because gravity again is going to pull that your blood down towards your legs and create that pressure to try to reopen that vein. So those are the times to continue wearing compression garments. On somewhat of a consistent basis. It doesn't have to be like religious around the clock or like every hour of the waking day, but with some type of routine, wearing supportive socks or stockings or garments on their legs, and that can even include like yoga pants that are have compression, gym type pants, or some type of sporting, athletic gear that offers support to the legs. No, during that 3 to 6 month period is when it's most important. Yeah.
Okay.
And we do follow-ups. We'll do a 1 month follow-up after any procedure and just do that kind of initial check. The reason for that is if, for instance, a vein reopened, or maybe there's another vein nearby that with a shift of pressure that became a problem, we want to find that out right away, and we can go ahead and treat that. That additional vein if need be. Or if everything is great and looking good, then we'll make our next follow-up for 6 months later. And that kind of puts us on par with that time frame that I mentioned to you of when we would expect the final effects of the treatment to be.
Good.
Yeah, and we're doing, on each of those visits, we're doing a repeat ultrasound of the legs. We call it a duplex ultrasound. Yeah, one thing that's really nice about it and is a new sort of innovation with this product, the sclerotherapy procedure and even the chemical that is used in Varithena has been around for quite some time. It's called polydocanol. Is that chemical name, but the mixture that is in the way it's delivered is somewhat unique. So it is mixed in a specific gas mix of oxygen and CO2, so O2 and CO2. And then the concentration of that polydocanol is slightly different than what we had used in previous sclerotherapy procedures. So that particular product, the Varithena, is also useful and able to be used for closure of not just varicose veins, but what we call truncal veins. And those are veins that are slightly deeper in the leg, that tend to feed into varicose veins, or veins that become varicose with long-standing pressure. So the nice thing about that is what we had previously treated those truncal veins with catheter procedures, so-called ablation, and that was thermal or heat-based ablation. So the Varithena is appropriate for those veins, and that's a very significant innovation in that you don't have to worry about that thermal energy and that heat going into those larger veins. So it's a very, as I mentioned to you, somewhat simple procedure in getting that foam into those veins instead of passing a catheter and then having to numb up the whole course of that much longer vein to do the catheter procedure. So that's a major improvement, and that long period of research that the company did for Varithena was a big part of that was to make sure that that was going to be effective for those truncal veins. And the name, the saphenous vein is a typical truncal vein, the great saphenous vein, and then there's a small saphenous vein also. That is a typical truncal vein that the varicose veins would branch off of.